Yeah, very good evening to one and all. My dear friends, a fantastic evening. Very good evening to all. We are going to recall pharmacology session. So kindly post your question that I have calculated some question. We will discuss. The purpose is I have to get options, correct options, and we go for discussion to start. Yeah, a lady with diabetes was given some oral drug that reduces HbA1c from 7.6 to 6.7, and the drug also causes high GIP and GLP-1 level with low glucagon. What is the answer? Come on, anybody is there? Can you just chat with me? Say, Anam. Okay, right. So here they give oral drug, and the drug reduces HbA1c from 7.6 to 6.7, and drug also increases the glucagon-like peptide and insulinotropic polypeptide, and it causes low glucagon. If this question comes main, it should be either GLP-1 analog or it should be a DPP-4 inhibitors. Okay, because they are the one going to increase the GLP-1 level and going to decrease glucagon. But asking which is oral drug. So here, liraglutide, one of the GLP-1 analog. So the right answer will be gluten, DPP-4 inhibitors. But I think nobody is there. Anybody? Can you give me option D? What is the option? I don't know the option. If you give me, I can go for this. Anyway, answer for this question DPP-4 inhibitor like glutens. So this is what we take in the class. Next. Oh, last option agarbos. Very last of agarbos. Okay, doctor. Thank you. Thank you, Dr. Simbu. Yeah. So the answer will be here DPP like sitagliptin or gliptins. Okay. Now, question number 2. Ah, good. Sam Alba gliptin. Okay, good. Gliptin. Which anti-diabetic drug causes adverse effect of vulvovaginal pruritus? And then this is very simple question. Among the anti-diabetic drug, a drug causing commonly UTI, that too mainly fungal infection will be SGLT2, sodium glucose transport 2, SGLT2 inhibitor. I got only one option, canagliflozin. Can you Simbu and Sam Jodi? Can you able to give the other options also? It's very good to give the options. It's very nice for me to create a PDF for you. So one option, that's the right answer. It is AGLT2 inhibitor. That's the answer for the question. But can you give me the other option so that I can complete the full question? Any idea? Are you able to recut? Simbu or some anybody else? Others are there. Please help me. No idea. Okay. Next, prove regarding lithium. I think this is a very simple question because we discussed class of lithium, common action, adverse effect, all these things. Here the two lithium, fine tremor occurs within the therapeutic dose range, not observed orally, does not cause teratogenicity, upward fast sensation. They are asking here true regarding. Say, fine tremor is the most common adverse effect of lithium A1 on normal regular dose. So it's a true statement. It's answer. Not observed. No, it is completely absorbed on oral route, completely get absorbed and does not cut it. No, it causes teratogenicity called Epstein anomaly. It causes teratogenicity. An approved option. No, it's not got approval. It's not having anti-epileptic activity. So true statement answer A, fine tremor. That's answer. That is straight question, easy question. A patient with schizophrenia treated with clozapine advised to undergo periodic blood count monitoring because of which are the following side effects. I think this also straight hit seizure, egocytosis, bleeding, myocarditis. See, the drug causes adverse effect, seizure, egocytosis, bleeding, myocarditis. But you know, this drug causes agranulocytosis. That is 0.8 to 1% of people on this drug therapy developing this complication. That too, it's dose independent complication. Because of this problem, we advise the patient to undergo periodically complete blood count checkup every week, at least for the first 3 months. First 3 months, they should undergo periodically complete blood count checkup. The answer is option number B, agranulocytosis. Look at this is what we take in the classroom. That is, the drug causes dose independent agranulocytosis. Thus, we go for complete blood count checkup. And this was the old question, siluria. So, this was the old INICET, but they say they ask about agranulocytosis. Okay, next. Yeah, antidepressant causing priapism. I think this is also straight question. Anybody? The same question was given or any history was given, Doctor? Dr. Shakshamon Sharma. Can you answer whether the same question is given or they give any history like this? Okay. Actually, same question. Well, thank you. The answer was trazodone. Trazodone causes priapism. This we also discussed in our regular DVT class. The same picture I told, no? Antidepressant and sex is a very important topic for AIIMS exam. I told in classroom, AIIMS people fond of asking antidepressant sex problem. So here we discuss trazodone causing priapism, adverse effect. This adverse effect can be exploited for therapeutic use of I mean erectile dysfunction, useful for treating SSRI causing adverse effect and delay in ejaculation. That property was used for treatment of premature ejaculation. Priapism adverse effect trazodone. That property useful for treatment of erectile dysfunction. And among the antidepressant, mirtazapine having leads to sexual dysfunction. The same thing was discussed. Okay, so answer trazodone. And I think there's a matching type of question was came. I think option A column, B column, they given the receptor in which what they acting on. Here, mirror background. It's a beta 3 agonist. Isoproterenol. It's a beta 1, beta 2, beta 3 agonist. Betaxolol, a cardioselective beta blocker, useful for treatment of glaucoma, safe in asthmatic people. Indacaterol, a beta agonist having anabolic action also, has anabolic activity also. Okay, I think this is the same question. Can you confirm? Shaksham Simbu, Sam Jodi, can you confirm this question is came? Over the matching type of question, they're given some drug and the receptor is acting. Okay. Mirror background, a beta 3 agonist useful for treatment of overactive bladder, and isopetanol beta agonist, betaxolol, a beta blocker, that's beta 1 blocker, indacaterol, a beta 2 agonist. Am I right? If you say okay, mean I can proceed to other question, doctor. Is the same question or any change in options, doctor? I think same question. Yeah, thank you. Thank you. Now, right. Now, next question. HER2 positive trastuzumab resistant breast cancer. What is the treatment? See, normally for treatment of HER2 positive breast cancer, we go for monoclonal antibody called trastuzumab. If it is resistant, we go for some other type of options. Given, see, the option given are NIB. That means asking about tyrosine kinase enzyme inhibitor. Actually, it's a very easy question. Somebody telling it's a tough question. It's not tough. It's simple. You can easily rule out the question. For example, sorafenib useful for RCC. Vemurafenib useful for malignant melanoma, and LOT useful for non-small cell lung cancer. Lapatinib useful for treatment of breast cancer. In this way also we can use. Okay, actually all the NIPs are tyrosine kinase enzyme blocker. For trastuzumab resistant breast cancer, that to HER2 positive cancer, we can go for lapatinib. Actually, we have two important drugs. One drug called lapatinib. It is active against HER1 and HER2 positive breast cancer. And one more newer drug called neratinib. It's useful for HER1, HER2, and HER4 positive breast cancer. Okay, I think it's a simple question. Lapatinib useful for HER1 and HER2 positive breast cancer. One more latest is just giving me neratinib. Then I think this question little bit tough question. Okay. Osimertinib useful for non-small cell carcinoma with the mutation due to, I think, really tough for undergraduate. Actually, you may know osimertinib, a tyrosine kinase enzyme inhibitor targeting against epidermal growth factor receptor, useful for treatment of non-small cell lung cancer. That is understandable. But mutation at what level? I think difficult. The right answer is T790M. This is the right answer, but I don't know what are the other options that are given. Can you able to recollect? I'm waiting for some time. See, actually, there are a lot of tyrosine kinase enzyme inhibitors available targeting against EGFR. EGFR means epidermal growth factor receptor antagonist. For example, gefitinib, elotinib, afatinib, osimertinib, docomotinib, all are useful for non-small cell lung cancer. But here they're asking about mutation due to what level? That's the problem. T790. Okay. So option A. Don't worry if this question is difficult for you. Mean whole India, all people may find difficulty for this question. So don't get panic. Okay. So do you able to remember the other options? B, C, D options. If you're able to know me, if you able to recall me, please post me in my Facebook ID or our DAMS-eMedicoz official Telegram. Okay. So please. Next, I think another easy question, therapeutic index based question. Today they ask about mostly anti-diabetic drug, some psycho and psychiatric drugs, some clinical trial based general pharmacology. That's how they finish whole pharmacology, INICET and cancer. So only 4 years they touched. One area diabetes question, two question endocrinology, 2 to 3 questions from psychiatry paper, and 3 to 4 questions from clinical trial, and 4 to 5 questions from anti-cancer. That's all. Whole pharmacology over. Okay. Yeah. Now look at me. Therapeutic index. This question I think easy. It's LD50 by ED50. I don't know what is the fourth option. Can you just able to recap the fourth option after? Therapeutic index. Indicate LD50 by ED. Actually, it indicates safety of the drug. It's not efficacy, it's safety. Therapeutic index indicates safety. Okay. Now, this question came or not, I don't know. Come on, be proactive. Can you answer? Morphine antidote. Whether this question came or not, doctor, somebody posted in my Facebook ID. Morphine antidote. It's a easy question. Intravenous naloxone is the first line choice, but naloxone is a short-acting drug, followed by we use oral naltrexone we give. Whether this question came or not, I don't know. Yes, came. Wow. See, they're asking two extreme. One extreme very tough, other extreme very easy. Okay. Morphine antidote is intravenous naloxone. Well, what about other option, doctor? Do you able to recollect other options? What about other options? No idea. Harsha, can you able to recollect the other options? Okay, no problem. Right. Ah. A kid went to temple with grandmother, constantly crying. BP 150/90. BP was high, and heart rate also high, and cold periphery. What should be given? I think this question almost easy question. A kid went temple with grandmother, constantly crying. BP 150/90. See, the baby crying, BP also increased, heart rate also increased, and the cold periphery. That means there is something sympathetic overaction causes high BP, high heart rate, and vasoconstriction, cold periphery. So maybe a case of scorpion bites. I think scorpion bites. So according to me, the answer will be option C, processing. What about other option? Can you able tell the other option? Priapism was mentioned. Oh, priapism was mentioned. Okay, okay. Priapism was mentioned. Okay. Uh, Even then we can go for processing because this question. Oh, other option? Steroids. Steroid was other option. Okay. But related to the question, the appropriate answer can be option C, processing, after processing. This is what problem. Latest drug approved for Rett syndrome. This question really tough, doctor. Really tough. Okay, because it's not pharmacology question. It's a totally neuropsychiatric. Rett syndrome is the problem in babies. Genetically mediated problem where there is a neurological problem and developmental problem. For this one new drug got approval, the right answer is trofinetide. Mechanism not known, it is the right answer. But based on the other option, you can rule out and reach diagnosis. If we tell the other option, I can able to say how to rule out. Actually, this we are not taught in class, really, because this was latest in March 23. Only this drug got approved. Within 2 months, they asking the question. Okay, this was happen in INICET. They may ask some latest because the question set by the MD pharmacology or DM pharmacology P student, I think so. When they study about new drug, they ask the question. And DM pharmacology doing some journal club. When they do some journal club, they come to know some latest point from journal from the clinical trial asking. Okay, that's what I think so. Okay. Okay. The other three options can ruled by nomenclature. Okay. So based on the other option, I think we can rule out the option and reach a diagnosis. But this question is a really tough question. Okay. Sparsentan. Oh, sparsentan was given another option. Sparsentan. Sparsentan. See, sparsentan. Sentan. Both senten. Sparsentan. Sentan. That means endothelin. Okay, Harsha, good ma. So based on the option, you can see. If you're able to recall the other option, please kindly post in eMedicoz official Telegram. Okay. Okay, it's ruled out. Okay, answer trofinetide. Keynote trial. Pembrolizumab and nivolumab. I think what to say. For undergraduate, this question totally pathetic. Okay. See, if they ask about pembrolizumab, that's good, man. Keynote trial. So these are name given to a trial. We conduct in phase 1, phase 2, phase 3 clinical trial. No, for that we give some name. Keynote trial. Actually, pembrolizumab, one of the immune checkpoint inhibitor, useful for non-small cell lung cancer as well as breast cancer, so many cancer. But they done one new trial. The trial says, see, what's called, there's a trial funded by Merck called Keynote 189 clinical trial. The name of the trial is Keynote 189 trial. This trial shows pembrolizumab to standard chemotherapy with, that is pembrolizumab plus pemetrexate plus platinum based therapy will be very much improved in the progression free, they will improve the survival rate in case of non-small cell lung cancer. So according to the trial, the answer will be pembrolizumab with chemo given for non-small cell lung cancer, that they have long survival rates and better prognostic. That's the answer. But keynote trial and all difficult for undergraduate. Pembrolizumab, if this question, okay. Anyway, the answer for the question is option A, pembrolizumab with the chemo given for non-small cell lung cancer. That going to very good benefits. The trial name is my keynote 189 clinical trial. This was published in NMJ, New England Journal of Medicine. So it's the latest one. And this question somebody posted, but exactly they're not posted the option which is not related to teratogenic effect of thalidomide. Can you able to tell the answer? Because I'm not able to reach diagnosis because they're asking which is not related. See, actually it causes Pocomelia, occurs ceiling. It is mainly due to antagonistic action on angiogenesis. It's a VGFR blocker. So because of blocking vascular growth factor, okay, angio, okay, one more option, interleukin 2, interleukin 5. Bind Globen like this question I will verify and tell you, doctor, because they ask about not related. It actually related to anti-angiogenic factor, but they given not related. Okay. Auxin free radical interleukin 45, interleukin 2, 4, interleukin 45. Oxygen free radical formation 4 and 5, interleukin 4 and 5. Okay, this I'll verify and tell you, doctor. Okay, wait. Next, whether this question came or not, cyclosporine mechanism action based question came or not. Actually, we cyclosporine going to bind with the cyclophilin, thereby going to inhibit calcineurin pathway, thereby inhibit synthesis of interleukin 2. Okay. Oh, now ask about cyclosporine causing cholestasis. Cyclosporine causes cholestasis by what mechanism? Options are cyclosporine causes cholestasis by what mechanism? What option given? Can you able to MRP, OAT1, OAT1, OPT1, MD, MD or MRP2, OAT, MRP, MD or OPT, OPT 1A. Okay, this also I verify and I will make a good notes. Don't worry. OAPT, sir. Organic. Okay. OAPT. OAPT. Okay. This I will make you notes. Don't worry. This question came, doctor. Scale used for pancreas dosing. This and all very tough level, doctor. For even a third year pharmacology PG cannot able to tell the answer. See, we used to teach vancomycin cause in nephrotoxicity based on the serum creatinine value. We will adjust the dose. That was what we say. But Sairam, I think you are right answer. Don't worry. Sairam, you are the right. Scale used to whether they given nomogram, doctor, nomogram, or they given any NHS. Okay, whether this option is given, I don't know what option given. Scale used for conducting. If this option given me, this is also one answer, this is also right answer. But no, oh yeah, they give nomogram. Yes, Harsha, good. Yeah, and if this means this is also one answer, this is also nomogram was there. Yeah, then this is the answer. This is the answer because nomogram was one of the name given to scale on when the dosing scale based on the serum creatinine. Okay, one Salazar. Okay, by right answer, nomogram, doctor. Okay, and what is one? Any other option, doctor? Salazar. Any other option? Okay, if you're able to find answer, if you're able to find option, please post it. But the answer for the question, nomogram. Okay. Uh, any other question, doctor? Actually, we discussed about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 questions are very easy. 10 very easy. Even 11th question also easy. 1, 2, 3, 4, 5 questions are very tough, doctor. 11 questions are very simple, but 5 questions are repetitive. So remember me, out of 16 question, 11 state question, 5 in the 5, 2 question can be easy by rule outing the other option, but 4 question really tough, doctor. Any other options or any other questions, doctor? Can you able to get? We have so far recollected 16 question. Can you able to recollect any other question? Yeah, Simbu. Yeah, 11 questions straight question only. You only posted a question. 11 questions straight question only. 5 question, Indian 5, 2 question can be reachable by routing other option. 3 question really tough, doctor. Okay. Infection destined to corvinum, fluoquinum, but sensitive to piperacillin, pseudomonas. What man? Yeah, clinical therapy index true statement LD50 by ED50. That's the answer. So, Kumar, the therapy index question LD50 by ED50. I don't know what is the other option, but the answer is LD50. Okay. Infection resistant to carbapenem. Sinam. What is the question? Infection resistant to carbapenem, fluoroquinone, but sensitive to piperacillin, Pseudomonas Burko. Hey, your spelling. I'm not understanding. Sairam, your question, the spelling, I'm not understanding. Only two things are carbapenem, fluoroquinone, I understand. But sensitive peptas, Pseudomonas Burko, that not a, okay. Sensitive to levofloxacin and cotrimoxazole. Okay. Cotrimoxazole. Okay. Infection resistant to carbapenem, fluoroquinone, but sensitive. Which infection? Pseudomonas. Oh, causative organism was asked. Okay. That you ask for a microbial Dr. Surya, expert Surya. You ask for, okay. Causative organism. Okay, Sairam. Thank you. And any other questions mean kindly post. Okay. And also please note, please post in Facebook or else at least post me in WhatsApp. So, post me in WhatsApp or eMedicoz official Telegram or eMedicoz Facebook channel. Okay. One more question, Saram. What question? Can you please post? I don't know. You have to tell me what the question. If you're able to recollect me, well and good. Otherwise, no problem. Recollect the question and post it to my ID. Okay. So may God bless you. I think most people commented PSM and pharmacology was really tough. Okay, it's not tough. 11 question easy, no. 3 question really tough. 2 question can be easily doable by routing other option. Anyway, if you feel tough for 3 question, it's tough for all students. So don't worry. That is not going to decide your rank. God bless you. All the very best. Thank you. Oh, Rett syndrome. I told you that's torn. Okay, about pneumonia case, cephalosporin plus sevoflurane marked as Oflux, levoflux, moxiflux, respectively, like thought. Okay, good, Saram. Good, Saram. Good. Okay. Shall we finish with this? And Sairam, you please note my number. Sivakumar, Dharma, Harsha, Simbu, all please note my number. Please kindly post whenever you recollect the question. Please try to post at least by tomorrow so that I can prepare a good video for you, definitely useful for you as well as for your juniors. So please, okay, thank you. With this, we finish the show. Thank you very much. All the very best. Thank you.